What is bronchitis? Bronchitis is an inflammation of the bronchial tubes, which carry air to and from the lungs. This condition causes swelling and increased mucus production, leading to coughing and difficulty breathing. It can be acute, short-term, or chronic, long-term. Types of bronchitis. 1. Acute bronchitis. Temporary condition lasting up to 3 weeks. Often caused by viral infections like the common cold or flu. Can also result from bacterial infections or irritants like smoke or pollution. 2. Chronic bronchitis. A long-term condition that is part of chronic obstructive pulmonary disease, COPD. Defined by a productive cough lasting at least 3 months in a year for 2 consecutive years. Typically caused by prolonged exposure to irritants such as tobacco smoke, dust, or chemicals. Causes. 1. Acute bronchitis. Viral infections. Most common cause, e.g., influenza or rhinovirus. Bacterial infections. Less common, but may occur as a secondary infection. Environmental irritants. Smoke, fumes, air pollution, or allergens. 2. Chronic bronchitis. Smoking, leading cause. Air pollution or workplace exposure. Dust, chemicals, and fumes. Repeated respiratory infections. Weakens lung defenses over time. Symptoms. Persistent cough. Can last for weeks. Often produces mucus, clear, yellow, greenish. Shortness of breath, especially with physical activity. Chest discomfort. Feeling tightness or soreness. Wheezing. Whistling sound when breathing. Fatigue, due to reduced oxygen levels or prolonged coughing. Low-grade fever and chills. Common in acute bronchitis. Sore throat or nasal congestion. Often present if caused by a virus. Diagnosis. Medical history. Symptoms and exposure to irritants like smoke or allergens. Physical examination. Listening for wheezing or abnormal lung sounds with a stethoscope. Tests. Chest X-ray, to rule out pneumonia or other lung conditions. Sputum test, examines mucus for infection or signs of inflammation. Pulmonary function test, checks for airflow obstruction, especially in chronic bronchitis. Treatment. 1. Acute bronchitis. Rest and hydration, helps the body recover and thins mucus. Over-the-counter medications. Cough suppressants, for a dry cough. Expectorants, to loosen mucus for easier clearance. Pain relievers, acetaminophen or ibuprofen for fever or discomfort. Inhalers, if prescribed, for wheezing or breathing difficulty. Antibiotics, rarely needed unless a bacterial infection is suspected. 2. Chronic bronchitis. Lifestyle changes. Quitting smoking. Avoiding environmental irritants. Medications. Bronchodilators to open airways. Inhaled corticosteroids to reduce inflammation. Pulmonary rehabilitation. Exercise, breathing techniques, and education. Oxygen therapy, for severe cases with low blood oxygen levels. Vaccinations, flu and pneumococcal vaccines to prevent infections. Prevention. Avoid smoking, the most effective way to prevent chronic bronchitis. Reduce exposure to irritants. Use masks or air purifiers if necessary. Frequent hand washing, to minimize the spread of infections. Stay vaccinated, annual flu shots, and other recommended vaccines. Boost immunity, through a balanced diet, regular exercise, and adequate sleep. When to seek medical help. Contact a healthcare provider if you experience a cough lasting more than 3 weeks, high fever or persistent chills, shortness of breath or wheezing, blood in mucus. Symptoms of chronic bronchitis worsening. Would you like information on managing symptoms or a deeper dive into any specific treatment?